and Assalamualaikum. Today we are going to present the article review titled The Impact of Education Level on Individual Lifestyle Behaviors Among Dietetic Students and Professionals. So this is our group members. I'm Nisha Aida Izzati as the editor and presenter. Next, Nur Nazura Izzati, Nini Nur Syafiqah Aliana, Nurina Nabila and Nur Azami Ashikin. Four of them taking a role as a presenter.
For the summary of this article, the study mainly discussed the relationship between education level and lifestyle behavior among dietetic student and professional. Since they are involved in the nutrition field, they are expected to encourage the healthy lifestyle and guide others in making better health choice. However, the researchers wanted to know whether the nutrition knowledge they learn during their study actually affect their own lifestyle. In other words, do they really practice what they know? These include their eating habit, sleeping patterns, and physical activity. So the main aim of the study was to examine how education level influenced their lifestyle behavior. The researchers wanted to know whether receiving more nutrition education will lead to healthy lifestyle practice among dietetic students and professionals. Moving on to the methodology, this study involved 71 participants from Poland, consists of dietetic student and professional. The participants were divided into several groups, which include first-year bachelor student, second-year student who were observed over 1 year, and master student who present the professional group. The study also included dietitians who already graduated, allow the researcher to compare students with those who were already working in the field. To collect the data, the researcher used a validated questionnaire of eating behavior. This questionnaire was used to assess several important aspects such as dietary habit, nutritional knowledge, sleep duration during both weekday and weekends, and physical activity level. Besides that, the questionnaire also helped the researcher measure diet quality score and evaluate the participant overall level of nutritional knowledge.
Okay, so next I'm going to explain about the findings from the article that we studied. So the first one is higher education improve nutritional knowledge. Dietetics professionals demonstrated a significantly higher nutritional knowledge than students, showing that nutrition education effectively increased knowledge. The second one is better knowledge did not result in healthier eating behaviors. The study shows that although participants had greater nutritional knowledge, it did not significantly improve their dietary habits, diet quality or BMI, highlighting a gap between knowledge and actual practice among dietetic students and professionals. And the last one is higher nutritional knowledge was associated with shorter sleep duration. Participants with higher nutritional knowledge and healthier dietary patterns tended to sleep less. This may suggest that dietetic students and professionals prioritize nutrition and dietary practice more than sleep hygiene, as they focus heavily on academic responsibilities, professional developments, and healthy eating behaviors. The importance of adequate sleep may be overlooked.
Next is the strength of the study. First, the study focuses on a novel research topic. It is one of the first studies to examine nutritional knowledge, dietary habits, and sleep pattern and physical activity together among dietetic students and nutrition professionals. This helps address a gap in existing literature and provide a more comprehensive understanding of their lifestyle behaviors. Second, the study uses a prospective and comparative design. The researchers follow first-year dietetic students for 1 year and compare their results with nutritional professionals. This approach allows for a better understanding of changes over time and differences between the two groups. Finally, the study utilized the validated Compact questionnaire to assess dietary habits and nutritional knowledge. Using a validated research instrument, improved the reliability and consistency of the study collected, making the findings more credible.
Explaining the weakness of this article, the first point is the gender imbalance. There was a substantial imbalance between male and female participants, with one gender being significantly overrepresented in the sample study. This uneven distribution may not accurately reflect the overall demographic composition of dietetic students, limiting the representativeness of the finding. Furthermore, the gender imbalance restricted the ability to perform meaningful comparison between male and female students, making it difficult to identify potential gender-related differences in sleep quality, dietary habit, and nutritional knowledge. Next is small sample size. The study was conducted with a relatively small sample of 71 participants consisting of 37 bachelor degree students and 34 master's level professional. The limited number of participants may reduce the statistical power of the study and restrict the ability to detect significant relationship between the variables being examined. In addition, the small sample size may not adequately represent the diverse characteristics, lifestyle, and experiences of the entity student and professional in different institutions or regions. Lastly is self-reported data biases. The study relied on self-reported questionnaire and interviews, making the data vulnerable to recall bias and social desirability bias. Participants may not have accurately remembered or reported their sleep duration, dietary intake, supplement use, and physical activity levels. Since these lifestyle factors were assessed subjectively rather than through objective measurement, reporting errors may have affected the accuracy and validity of the findings.
Next, I will discuss the relevance of this study. First, the study helped to bridge the gap between knowledge and practice. The findings show that having higher nutritional knowledge does not always lead to healthier lifestyle behavior. Although nutrition professionals had significantly greater knowledge than students, their eating habits were not significantly healthier. This suggests that knowledge alone may not be enough to change behavior and highlights the need for behavior change strategies in nutrition education program. Second, the study emphasizes importance of holistic lifestyle approach. The researcher examined multiple lifestyle factors including diet, physical activity, sleep, and nutritional knowledge. The finding revealed that good nutritional knowledge does not necessarily guarantee healthy sleep habits. Since poor sleep is linked to obesity, hypertension, cardiovascular disease, and reduced well-being, the study demonstrates that health is influenced by several interconnected lifestyle factors rather than diet alone. Therefore, nutrition intervention should address multiple aspects of lifestyle to promote overall health.
The third one is to identify the neglect of sleep hygiene. From the article, the results show an inverse correlation between nutritional knowledge, healthy dietary practices, and weekend sleep duration. Students with higher nutritional knowledge and healthier dietary habits tended to report shorter sleep duration on weekend. One possible explanation is that these students may maintain more regular and consistent sleep schedule throughout the week. As a result, they may have less need to catch up sleep on weekend compared to students with less healthy lifestyle habit. However, it is important to note that this finding only shows an association and does not establish a cause and effect relationship. Despite the shorter weekend sleep duration observed, adequate sleep remains essential for overall health, as chronic sleep deprivation has been associated with an increased risk of cardiovascular disease, hypertension, and obesity.
Okay, next I'm going to talk about the application in real life settings. So first is how university need to change. So right now, program are focused heavily on the training the student on how to treat the future patients. However, the research found that we need to redesign this curriculum to include the self-management module, which is we need to actively teach these future medical professionals how to apply the theoretical knowledge to their own lives. So the second one is university must introduce the targeted sleep hygiene workshop, which is the data show an alarming trend, which is academic pressure and nutritional knowledge are low, but the sleep quality are drastically drops. Especially is during the transition from the first to second year of study. So we need to specific mental health and sleep support to combat this culture of sleep neglects. So the third one or final of the application is we need to stop relying on the self-perceptions, because the study highlight that while people are highly accurate at testing their own knowledge, but they are terrible objectively looking at their own eating habits. So in the real world, both students or working professionals need to use the validated tracking tools like something wearables or food logs, so rather than just guessing how healthy they are. Moving on to the real world implications, the most profound finding is the knowledge behavior gap.
So we assume that education can solve the bad habit, but it doesn't. The knowledge exactly what to eat does not automatically protect the student or professionals from making the poor dietary choices or grabbing fast food when they are stressed or busy. So this leads to the dangerous trade-off. Nutrition and exercise are heavily prioritized, but the sleep is completely ignored. So this creates a massive irony in healthcare field where the health and experts are actively raising their own risk for civilization disease like obesity and high blood pressure, and completely undoing the benefit of their healthy dietary simply because they are not healthy. So lastly is we have to look what happened when the student transitions into the working professionals. So their lifestyle foundations completely shift. So they suddenly have more money but have far less time for food preparations. So this real world setting explains why working professionals are actually show a distinct spike in fast food consumptions alongside the dietary shift toward the white meats.
After reviewing this article, I realized that having knowledge about nutrition does not automatically guarantee healthy personal behavior. I found this study interesting because dietetic students and professionals are expected to practice healthy lifestyle. Yet the article showed that higher nutritional knowledge did not always lead to better eating habit or healthier sleeping pattern. This made me realize that changing lifestyle behavior is much more complex than simply gaining knowledge, as factors such as stress, workload, time constraint, and daily routine can also influence personal choice.
This article review improved my understanding of nutrition research and its role in evidence-based practice. By analyzing the study, I developed my critical thinking skills and learned how to evaluate research findings more effectively. Overall, the experience enhanced my knowledge and confidence in interpreting scientific literature.
This article review enhanced my understanding of nutrition research and its importance in supporting evidence-based practice. Through critically analyzing the study, strengthened my critical thinking skills and gained greater confidence in evaluating and interpreting scientific findings. The review process also fostered a sense of responsibility in ensuring that information is assessed accurately before being applied in professional practice. In addition, discussing and exchanging perspectives with peers encourage cooperation and teamwork, allowing for a deeper understanding of the research. Overall, this experience broadened my knowledge, improved analytical abilities, and reinforced the values of responsibility and collaboration in the field of nutrition and dietetics.
This article made me realize how easy it is to fall into the trap of thinking that because I am studying health or researching nutrition, I am automatically living a healthy life. The reality is that knowing the difference between healthy and unhealthy choices does not protect me from the poor habits if I don't actively practice them. So this study is a wake-up call that academic expertise means nothing if it only stored in my head and never implements them on my plate.
After reviewing this article, I gained a better understanding of the relationship between nutritional knowledge, dietary behaviors, and sleep habits among dietetic students and professionals. One of the most interesting findings was that higher nutritional knowledge did not necessarily lead to healthier dietary behaviors. This made me realize that having knowledge alone is not enough to change lifestyle practice. The study also highlighted the importance of sleep hygiene, which is often overlooked despite being a key component of a healthy lifestyle. As a dietetic student, this article encouraged me to reflect on my own habits and the importance of applying theoretical knowledge not only in professional practice but also in daily life. So that's all from us. Thank you.